Awesome.
So we're joined from the great town of Vicksburg by my one of my favorite students of all time, Raymond High School, class of 2015, Delesha Butler. And she is also joined by Rebecca Lloyd. They are outpatient therapists with River Ridge Mental Health. Is that the new name of it?
Yes.
Formerly Warren Yazoo Mental Health. We are so grateful for y'all to take some time for us today to talk about this important topic. I've got a room full here with me at Velma Jackson High School. It's for our college career readiness class. We're recording this for all of our friends in Madison County schools, Madison Central High School, Ridgeland High School, Germantown High School, the Academic Options Center, and our YouTube channel. So thank y'all for taking some time out of your schedule today.
Thank you for having us.
Yes, we're so excited to be here and talk about this.
Well, before we get into that, because I do want to spend some time on that, is obviously Delicia's one of, I was telling them before lunch, you've been sitting where all them are sitting. You were one of my former students at Raymond High School. And still, I've been teaching 11 years. That class you were in is still my all-time favorite class.
Yay!
We had some amazing conversations. There's so many great students in that one particular class. But then you went to Hines Community College and then to Jackson State. And I'm wearing my Jackson State shirt today. So, but I have several seniors. I have almost all seniors in here that are doing a variety of things when they graduate. So just talk about, and Rebecca, I don't know your background, but you can talk about yours as well. Your background, leaving high school, and then those decisions you made to further your education after high school.
Okay, so I transitioned from Hines Agriculture High School, known as Hines AHS, located on the Utica campus. They're no longer open, so I transitioned to Raymond High School my 12th grade year, where I met the lovely Coach P. Coach P, he welcomed us with open arms, literally. He made me very much so comfortable in his class. He was very patient. I was nervous because I'm like, this is a lot of kids. It's something I'm not used to. It was so diverse, all ethnicity, cultures, everything. So it was quite different. Coach P, he prepared us for the real world. He made sure we took it serious. And I graduated from Raymond High School. I wasn't sure where I wanted to further my education, but then my mom, she informed me of Hines Community College in Utica, which provided me with great resources. I felt like home, which I was right up the road, so I commuted every day. I majored in general studies. I stayed there for 2 years, which I transitioned to Mississippi College in Clinton, Mississippi, where I majored in criminal justice and sociology. Look, I took up so much, Coach P. I gotta remember what it was, but I got my bachelor's at Mississippi College, and that was a great experience. I actually stayed on campus there. Then I transitioned to online courses at Jackson State. The application was pretty easy. I did need guidance from my mom. Like my mom, she was my biggest supporter. Well, still is my biggest supporter. She helped me with the process and everything, financial aid wise, all of that. And I spent 2 years in the master's program at Jackson State. I did online. I did not go on campus for anything. I did do internships as well, which prepared me for what I do now. Interning is very important. And that's about it. And I graduated.
Now, yeah, just to clarify on that, and I forgot you going to Mississippi College because that social work program at Mississippi College is phenomenal. One of the best in the area. I've forgotten about that. But that Jackson State Master's program you did, if I'm not mistaken, if you go on campus for that, you can get that done in 1 year, correct?
Correct. You can get it done in 1 year, actually online as well.
Wow. Okay, I did not know that.
Yes.
I did know that. I do know for that Master of Social Work at Jackson State, they offer a variety of master's programs. So that's another thing to consider considering master's programs is the length of time it would take to complete it. So that's good information.
Right. But before I transitioned to the master's program, I wasn't really sure where I wanted to go. So I did join AmeriCorps. AmeriCorps NCCC, which is stationed in Iowa. They do have different stations throughout the United States, but I was part of the Benton, Iowa team, and there they prepared, like, I gave back to communities. We traveled from Wisconsin, Pennsylvania, different states up north, and they gave
Wow.
me a time to, think of what I wanted to do. And when the pandemic hit, I did apply for grad school.
Yeah, and I know several of your classmates that at Raymond High and several alums we've had here at Velma Jackson. That first 2 years of community college, they live at home. It's not that they're not trying to get out, but it is amazing how much money you can save, especially in your case, just doing the general studies, getting your core classes out of the way. If you're sleeping in your own bed every night, that doesn't mean you can't get a campus experience, because
Right.
obviously Heinz Utica is the HBCU. They have HBCU status. You were still able to participate in the campus activities, but you were not
Yeah.
paying a few $1,000s for a dorm room.
Correct. And Heinz, they offer me so many scholarships. And the ACT, I didn't make the highest score. However, Heinz still worked with me, and I was able to get on a scholarship at Heinz. And I
Wow.
did work study. I did work study at Heinz and Mississippi College. That's great money. Look into it.
Now, Rebecca, what about your background?
Okay, so I went to Warren Central here in Vicksburg and graduated there in 2017.
Cool.
And from there, I was trying to figure out what I wanted to do. I knew I liked art. I knew I liked people and like talking to people and things. So I explored like art programs at Mississippi State. And then I also got into the psychology program when I went to the orientation that they have at Mississippi State before you actually start there. And it took my heart and made me just really want to pursue that program. So I ended up getting a bachelor's degree at Mississippi State. I did live on campus there and very much enjoyed that. One thing to keep in mind there is you do not have to live in the most expensive dorm to have a good time. I actually lived in the cheapest dorm there and I loved it. It was central on campus, right next to the stadium and everything. So, I mean, it was perfect. But anyway, so I got my bachelor's in psychology there. And then towards the end of the program, they get you thinking about like what careers you want to do and looking at jobs. And I was just looking at what I could do with my undergraduate degree, and I just wasn't satisfied with that. And so I started looking into graduate programs, and I found a program in clinical mental health counseling at Ole Miss.
Wow.
They also have the same program at Mississippi State, but theirs was more impressive to me. I got to meet a lot of the professors and stuff beforehand, and I actually got to go on campus for an interview, and it was amazing. So that's where I ended up going after that, and it was a 2-year program there. And like Delesha said, we did internships and things that helped to prepare us. And honestly, they had so many connections that I was able to make in Mississippi because I was on a grant that was on the Kellogg grant, which provided telehealth services to kids all over Mississippi. It was completely free telehealth counseling. And it was just a really great opportunity. And then another thing to consider with graduate programs at schools like that is they have like kind of like a work study, but it's a graduate assistant program. And it paid for all of my graduate program the whole time I was there. So definitely look into that if you consider going to a master's program. And then also at Mississippi State, I was on a work study that provided a job for me that was fairly easy and I could do schoolwork at. So that was good.
Yeah, and I'm glad you mentioned graduate assistantship. Now, I know they really have a ways before they think about that, but for somebody considering a master's, I was a graduate assistant at LSU. I didn't pay a dime for school. You know, no matter what your financial means are, having that graduate assistantship not only gets you the work experience, you get basically a free degree. So I think once you get into your field and your major, and you know you're going to do a master's program, those GA spots are really, really valuable as far as work experience and the scholarship. I cannot agree enough on that.
Yes, for sure. And I mean, I still use the skills that I learned in my graduate assistantships that I did throughout school. So definitely something to consider.
All right, now they're handing me some tough questions, and we'll get to those in a minute. But I do want to talk about what it is you guys do, because this is a very fast-growing field, and there's a more and more need for people of all genders, people of all races, people of all socioeconomic backgrounds to get into this, because the stigma has starting to be removed across rural Mississippi, because no matter what color anybody was in rural Mississippi, it was always like, no, we don't need to go see a counselor. We're fine. And you saw a lot of suicide rates rise in parts of rural Mississippi, Alabama, and other places. And you also saw untreated mental illness, which led to drug addiction. It led to crime. It led to abuse. And a lot of that could have been prevented if there were the resources. And I know that's why this field is really, really needs very talented and loving people to get involved in it. So talk about what it is you guys do, because I think you guys are doing some great work out there.
Okay.
Go first?
Well, I'll go first.
Okay.
Well, I am an outpatient therapist. My role is to provide coping mechanisms, therapy. I provide resources, whether the client needs to be hospitalized, needs to seek treatment in another county. It just all depends. I work with all ages. My youngest was probably like 5 years old to probably 80 something. It
Wow.
just depends. Yes. We're open Monday through Friday. We do have a crisis hotline, and they will connect you. We have different people on the schedule for after hours, because we close at 5. That's about it. Oh, and I'm over a program called the Enhanced Crisis Services. And we provide, it's a grant. We provide free services which cover medication, doctor visits, and therapy sessions for those who are in more of a enhanced crisis symptoms, basically.
Yeah. I'm also an outpatient therapist here. So I do a lot of the same things that Dee Dee does. I provide therapy. We talk about coping skills for dealing with like anxiety, depression, even bipolar and schizophrenia and things like that. I see a very diverse caseload. Like I think my youngest has been 4 and oldest has been 80, like she said. I don't think we see younger than that. So I do that, and then I'm also on the diversion grant here. And that is basically trying to divert people from going to the Mississippi State hospitals because they have been so overrun with people. So the way that I do that is we get a list of people that have missed doctor's appointments, because medication is so important to stay on when you have more severe mental illness. And so I work to make sure that they're getting into their doctor's appointments. And if they miss, I check in to see how things are going and things like that. So yeah, that's about what I do.
And I do want to include that we have offices in Fayette, Natchez, Port Gibson, Yazoo. Is it Centralville?
Yeah.
Yeah.
Yeah, but there's places just like us in every county, every region of Mississippi.
Right.
And we provide services, not us in particular, but there are services for people to have services come to their home and provide therapy. We have grants that provide free therapy, like her Enhanced Crisis Services grant. They get free doctor's appointments, medication, and therapy here, if you're able to qualify for that. And it really doesn't take that much to qualify. So definitely something to look into.
Well, and that's a great point, because no matter where, we have a variety of plans after high school in this room right now. We have some going to community college. We have some that want to work at certain companies. We have some going to 4-year universities. So we have a variety of plans. But it's, you talked about the internships. There are always people doing their internship on these college campuses. There are student mental health services at community colleges, at 4-year universities, because I think it's important to understand, no matter what you deal with, first of all, you're not the first person to have dealt with it. I'm not even a mental health expert, and I know that. So it's important for young people to understand, just because your family may not have talked about it, just because you may not understand it, there are people that will listen and can help you.
Yes.
For all you know, it can, when you talk to somebody, you could be triggered by something you never thought about. Being in a new environment, we're a small school. I know Raymond was small. I know Warren Central is kind of bigger. Raymond was small. We're a small school here at Belmont Jackson. I tell the story all the time. I went to Madison Central, graduated with over 500 people. And I had a class at Southern Miss. There was literally a guy in the class I knew my entire life, and I didn't even know he was in there until the last day. So it's easy to get lost in the shuffle. And if you're not used to that, that can be a mental health trigger. So it's important to reach out and use the resources. You know, you hear
Mhm.
people say all the time, I can't afford therapy. You may not be able to afford a high dollar psychiatrist, but there are
Yeah.
services that are always willing to help. And if they can't help you, they can find somebody who can.
For
I
sure.
agree. And I always tell my clients, I say, um, you're your biggest advocate. You
Mhm.
have to advocate for yourself. No one else is going to do it. If they don't see you going hard for yourself, they won't go hard for you.
For sure. Also, the on-campus counseling services are fantastic too. I
Mhm.
utilized them while I was there, just because the transition is so big and it's very hard, and anxiety that I didn't even know I had came up because of having to deal with all of that. So I definitely encourage y'all to look into that once you're there if you feel
Yep.
like you're maybe struggling a little bit and you need somebody to talk to.
And even while working in mental health, we also struggle with mental health. We have
Absolutely.
to. I go to her office in a minute and be like, Belka, like, let's talk about this real quick.
Yeah, we're lucky friends that are counselors. It's definitely helpful.
Yes.
Yep.
Now, and like I said before we started recording, at least, and I'm
Mhm.
not big on offering opinions on these, but in my opinion, I think the transition from high school to whatever your next step is the biggest mental health adjustment a person has to make.
It
So
is.
what are some things that you've seen people struggle with? And even if they've gotten help with it, what are some things, because you know, there's no point in sugarcoating for these kids. You're going to be
Mhm.
triggered by some things. So what are some major things you've seen people struggle with as they leave high school?
Depression.
Yes.
Depression. I know a lot of kids that suffer from depression and anxiety while in high school. So transitioning is depression and anxiety for sure.
Yeah, you're being away from your friends. You have to meet new people you might not even
Money,
realize.
money. A lot of
It's
them think
stressful.
about the financial aspects of it.
Yeah. One big one that I've also seen is there's kids that do so well in high school and
Mhm.
they're like excelling, they're involved in everything, and then they go to college and they're a small fish in a big pond.
Mhm.
And it's really hard to transition from that when you've been the top of your class and everything and then you start struggling. So that
Correct.
is another one that I've seen.
Correct. And when it comes to, you get distracted easily as well. That's a big one. And that's sometimes a person's biggest downfall because they become overwhelmed with so many activities that's going on that they forget they have an education. They got
Yeah.
to get their education.
Also, while now I know as high school students, y'all have access to like drugs and alcohol, there
Mhm.
is a huge plethora of access to drugs and alcohol in college, and it can take you down real fast if you don't watch yourself and be very careful. So I saw that plenty of times at Ole Miss and Mississippi State. So
And
just
we actually provide drug and alcohol services.
and they have that at both schools too, because they had sober tailgates and all of that for people that struggle with drug and alcohol addiction there too. So
Mhm.
there's
Yeah,
resources for everything.
yeah, and you know, when somebody goes and talks and seeks help, you know, a lot of these things are genetic. So you may be susceptible to
Mhm.
something that you know, it's nothing you did. You can't help who your parents are. So a lot of mental health triggers, whether it be alcoholism, whether it be depression, anxiety, any of that,
Right.
you know, you could have inherited it and not known it. So the worst thing is
Mhm.
not be treated and then not be medicated the correct way to cope with it, because you know, I dealt with mental health issues and I didn't have the same type of resources that is available now. So I think it's important for everybody that's here with me now, everybody sees us later, to know that you're going to face a mental health trigger at some point in the next few months. But how you deal with that, how you seek help for that, and how you're treated is literally something that could change your entire future.
Right.
Absolutely.
And it's best that you create a safe environment. Family is not always blood. So when you go to college, you're going to create a family. You're going to create a family. And
Yeah.
when you create that family, utilize it. Like, talk to them. You won't know until you open up. Don't be scared to open up to someone.
Yes, for sure. Find your tribe at school
Mm-hmm.
and be involved. That's the easiest way to make friends is to get
True.
involved in clubs and things like that. And I, as a person who really struggled with that and did not do it as well as I should have, I highly recommend doing that. So,
I
Yeah,
agree.
and even and not only from the networking standpoint of looking for a job, I think the worst thing you can do in college is just go to your room and go to sleep. When you start
absolutely.
withdrawing,
Right.
really
That's so
kill.
depressing.
Yeah. So,
Yes.
there's so many student organizations, so many activities. So find one or two things you like, and even if that's it, really find something that you can get involved in. Now, I do want to get to these questions. I've got some really good ones, so I want to get to as many as I can.
Okay.
And I told him to ask some tough ones. So I love this first one. This is
Oh,
Cornell
goodness.
Bacon. He's a member of our track team and football team and
Okay.
basketball team. He does a lot here. And bowling. I think he's done like 5 sports. But anyway,
Good.
That's
he
what I'm
said,
talking about.
Nice.
yeah, he says there's a lot of people that don't believe in depression. Did you ever feel that way? And if so, how did it change your mind when you realized that was not true?
Personally, I believed in depression because I've seen it in my family members growing up. And I don't think that I really realized until I was in this field that that's what it was. Whether it's like lacking motivation, not wanting to get up, and like wanting to sleep a lot and just feeling sad and down and maybe negative. So I think I didn't personally not believe in depression. It was more so just clicked in my mind like, oh my God, that's what was going on the whole time. And I had no idea that that's what my family members were experiencing. They probably honestly didn't even know either. So I think it's really just like people not wanting to recognize that depression is what is being experienced in them if they're probably denying it. Does that make sense?
I agree.
Okay.
Growing up in the African American community, we often push our problems off. We do not face reality, and as growing up, I've noticed a lot of symptoms in my family. That made me want to advocate even more for people because you have to speak up. You have to know that there are resources out there, people willing to help you with those problems because they are serious and fatal.
Yeah, for sure.
And that's a great segue to this question. This is Gavin Griffin, also a senior, Mr. 1A football in Mississippi, and just signed to play football at East Mississippi Community College. And he asked,
Congratulations.
he asked, what does it take to make a good mental health advocate?
I would say, I would say, knowing what you're talking about, doing your research. That's very, very important. Knowing your research and knowing that you have to take care of yourself before you take care of other people. I always tell people that I try to live by what I preach because how can I tell someone to take care of themselves when I'm not taking care of myself?
True.
Yeah.
I also think that empathy is a big part of that too. And I think a lot of times people get caught up thinking that the way people are treating them is because of how they're acting, like because of me, but really it's because of whatever they're going through, whatever they're experiencing, and just trying to remember that as a mental health advocate, understanding that they're going through something and you can advocate for them with your friends if they're talking about how this person was treating them and all that, if that makes sense. So
Yeah,
I think
and just
empathy is another one.
yeah, and I think it's important to remember that this doesn't mean somebody's evil. It doesn't mean somebody's crazy. It really is a
Right.
health crisis. It's just the same
Yeah.
as somebody having a broken leg or a broken arm. It's something that
Exactly.
I mean,
Yeah.
like we said, it can be environmental, it can be hereditary, but it's not something to shy away from. It's something that can be treated. I love this one. This is RJ Jones. He's a junior, and he asked, dealing and knowing with all of the effects that comes with mental health. What are some triggers that you have seen that have a huge impact on your work, and how do you tell people to overcome them?
Triggers. Oh, that's a good one. I haven't think
Yeah.
about it.
Coach P, can you repeat that question one more time?
Dealing and knowing all of the effects that comes with mental health. What are some triggers that have had a huge impact on your work, and how do you tell people to overcome them?
Okay. So I mean triggers can be anything. It can be mom yelling at you at home over and over again repeatedly and having to deal with that. It can be abuse of any kind, whether it's physical, emotional, anything like that. I mean, we see that all the time. I mean, it. So
Or just hearing a client's story too, you often try not to think about the things that you have been through because then you become emotional and you don't want to become emotional in front of your client.
yeah. What was the
Wow.
second? Yeah.
How do you tell people to overcome those triggers?
Oh, okay. So we introduce coping skills to them, and that can be things like if you're experiencing anxiety, taking deep breaths, counting while breathing. It can be grounding techniques like being mindful and trying to get your mind off of what's going on. And there's one called 5, 4, 3, 2, 1 grounding, where you look at 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell,
Wow.
stuff like that. 1
Yep.
thing you can taste. And all of that just kind of gets your mind on the present moment and off of the future maybe that you're worried about or the past that you're worried about. So
And also, in our office, we have like, motivational sayings, Play-Doh that the client can, just squeeze and fidget with while they're talking. Like if I notice that a client is becoming upset, I pay attention to body language. Like certain things would trigger a client, certain words you might say, or just talking about their past might upset them. So I pay attention to their body language, and I don't acknowledge. I just switch the subject, like ease the subject to something else.
yeah. Oh, another coping skill too, like for depression, it can be something as simple as getting up and taking a shower, just because that can be so hard for somebody that's
Yep.
in deep depression, or making a schedule and trying to stay on that so that you're not just sitting in your room in college and sad and making yourself go to class and making yourself go to clubs and things like that. So
That's useful even if you're not depressed. It's just a matter of time management. So I'm with you on that one.
yeah.
All right, this is Shania Kyle. She's a junior, one of our dancers here at Velma Jackson. And, I brag about her all the time. She moved here this year from Minnesota. So obviously
Whoa.
a different environment. And I think she has done a great job, and we've really enjoyed having her here at Velma Jackson. But she's got a couple of really good questions. She asked, first of all, why did you choose to get into mental health counseling? And do you ever feel like people take mental health as a joke?
Originally, I wanted to be a mortician, so there was a big leap for me. But I always knew that I wanted to help someone. I didn't always start in mental health. I actually started at the MDHS office, the Medicaid office. So it was a big transition. I saw that there was an opening. A friend recommended the job to me, and I accepted. And I fit right in. I did not like. Everyone was so welcoming, and they was like, "You're doing a great job, like girl, you was meant to do this." And so, just learning as I went, like I was learning as I go, and things were just coming off pretty. I'm still learning to this day. Like people recommend new ways for me to do something, and I take it. I don't feel like they're criticizing my work ethic or anything. I grow. I learn from it. That's the biggest thing. You have to be open-minded. When somebody is telling you a new way to do something, be open-minded to it. Listen to them.
For sure. My path was a little bit different because I kind of knew that I wanted to work with people for a while. So I got into the mental health field kind of watching a family member struggle with drug and alcohol addiction and watching that affect my entire family, and how while it was my uncle, it even affected my mom and dad and my sister and me. And just seeing him struggle with that so much really impacted me to the point of wanting to help other people that have gone through that, whether it's family members of people that have been involved in drug and alcohol addiction or the actual person. And I wanted to find a way to like make a difference in that and not feel like you have to be at home and just struggle with it alone and dealing with it in that way. So I would say that, and then my own struggles with like anxiety and stuff in college and going to counseling is what got me in the mental health field.
Awesome. I've got time for 2 more. This one is Dietrich Carter. He's a senior member of our football team and our track team, looking to get into the physical therapy assistant program at Hines, which is a great field, which also a lot of good people. But he asked, what is the hardest mental health disease to diagnose and live with?
To diagnose and live with. Well, they all come with a variety of challenges.
True.
For one thing, I think some of them are easier to see than others. I would say, what would you say is the hardest one?
I can't
Because
pinpoint.
I mean, I could see borderline personality disorder being
Yes.
difficult because
Yes.
it can present very similarly to bipolar disorder.
Mhm.
But there are a few things that are different in that way, and I'm honestly still learning what those things are. But
And
it's
sometimes you
Yeah.
don't see symptoms too until like you'd have been diagnosed with something, and
Yeah.
then you see like, okay, during therapy sessions, okay, now I'm starting to notice
kind of
this.
yeah.
So,
Yeah.
but I think the hardest one to live with, in my opinion, would be schizophrenia.
Yes,
That's
I would say schizophrenia because it's so persistent.
mhm.
And at times, medication works great for schizophrenia, and you're not having hallucinations and hearing things and stuff like that. But at times, the medication quits working, and then you're at home and you're by yourself and you're hearing stuff that you think is real. It's not real, and it's very scary. So
Mhm.
I agree. Schizophrenia was a good answer.
Yeah, and that's the thing, people think that mental health doesn't have breakthroughs. There are breakthroughs in mental health all the time. So there's always new medications, new therapies, new practices that really can change the way people live with this.
For sure.
I agree.
We always have people coming up here talking about new medications that are coming out too. So that's great
Mhm.
to remember.
I got one more. This is Cameron Murray. He's our Mr. Velma Jackson, also state honor choir member of the band, baseball. He does a lot here as well. But he asked, what is the main reason people should consider mental health to be serious?
Because it can be deadly.
Mhm.
We have a ton of suicidal clients that come up here. And it ranges from just feeling like they don't want to wake up in the morning all the way to they've attempted twice the day before.
Mhm.
So untreated mental illness can turn into something that makes you feel like I don't want to live anymore. And if you get to the point of wanting to follow through with it and you have access to it, you can die from it. So
Mhm.
I would say that is, the most important reason.
And pay attention to symptoms. If you see that someone who's typically bubbly and just full of joy, or you see the slight change, just check in and be like, hey, you good?
Yeah.
You cool? What's going on? Do you want to talk about it? And if you can't get through with it to them, tell the teacher, be like, so I feel like something's going on.
Mm-hmm.
Can you check on this person for me?
Mm-hmm.
And don't speak about it in front of everyone. Pull the teacher to the side, pull that person to the side.
Yeah, for sure.
Yeah, and that's the thing I can't stress enough. No matter where you're in school, out of school, there's always going to be people to help. So don't think that.
Agree. I agree.
Yeah. So like I said, it always goes back to, well, I can't afford to talk to anybody. Well, you don't have to be able to afford. There are people out there that can help you.
I agree.
Now we're almost out of time, and I thank y'all so much because this is such an important issue to me, and to our district. But a couple things before we go. First of all, why should these kids that may be kind of unsure what they want to do consider a career in mental health?
Well, it can be fulfilling when you get to see growth in your clients. That is one of the best feelings that I've had is experiencing a client getting better and feeling better and feeling like they can deal with all the things that they were struggling with. That's the main thing is that it can be really fulfilling.
And mental health, it affects the way you feel and act. And you don't have to be a therapist just to work in mental health. There are different programs. So like I said, you got drug and alcohol, you have school, you have child and adolescent. There are different areas you can work in when it comes to mental health.
Yeah.
You're always helping, and it feels good to give back to your community.
Yeah, for sure. I mean, just on our campus, we have so many different people that work here and do a variety of different jobs in mental health. So, yeah.
Absolutely. Now, the last thing before we go, and Delesha, I gave you time to prep this one, so I told you what I was going to ask. It was just 9 years ago that you were sitting exactly where all these kids are sitting as one of my students, and I am so proud to call you a former student. And you're one of the most amazing young people I've ever had. So I'm proud of you in that regard. However, you spent every day of your senior year with me. Did everything I told you was going to happen in life actually happen?
Yes. I'm telling you, Coach P is that man. Listen to him, okay? Listen to him. Take his advice. If you need some type of guidance, please go and speak with him. He will guide you, seriously. I appreciate you, Coach P, even to this day.
Well, the pleasure's all on this side of the camera, so I appreciate it. So again, I know y'all have a busy schedule. Thank y'all so much for joining us. Delesha Butler, Rebecca Lloyd, they're at River Ridge Mental Health in Vicksburg, Mississippi. Thank you so much for joining us today.
Thank you for
Thank
having us.
you. We have a
Enjoy the
good-
rest of your day.
All right, see ya.